here to give you a patient's view of interacting with pharma, speaking from my own experiences and observations as someone living with MS and RA, sharing what companies are doing, what they have done, what they could be doing, perhaps telling you some things you don't want to hear and some that you do. Get ready, get set, engage. Companies are actively engaging patients online, even if in a limited way. These projects are nice, and they frequently show up before a new product launch. However, they're quickly abandoned. And often, especially if they only existed to collect contact information, which is unfortunate. Some bloggers begin with the intent to connect to other patients or to help heal, as diabetes blogger Carrie Sparling often says. Not me. I started my blog to talk about health policy, big pharma, and my struggle with financial assistance. Now my blog is all about relationships, with disease, with health, with life, and with friends. Sometimes we talk about drugs. Patients like myself are educated, empowered, and engaged, leaders within our community. We research, we share, we help others while we help ourselves. Often people listen to what we have to say and ask us questions. We're the folks that companies hope will become their brand advocates. Last summer, I was contacted about a project to inspire the MS community. Originally, I ignored the emails, but a persistent PR rep got me on the phone and we talked about vlogging. With a lot of trepidation, I agreed to join the project, and as a result, I gained a lot of flack from my MS blogging community. This is a screenshot from one of my vlogs during which I decided to discuss yoga that day, with a little silliness included. Now, even I was surprised to see the entire 6-minute video go live. In fact, none of my vlogs have been edited, and the result is an honesty and sincerity which no pharma company could conjure from scratch. We discuss living with MS in a positive yet realistic way, even the most embarrassing stuff. Basically, what we already do in sharing our lives online with others. Unfortunately, comments are not enabled and readers can't reach back other than to click and give us kudos. So we, the vloggers, started a Facebook page. Pharma may reach out to patients or wish to through social media or communities. That's fine and good, but sorry guys, you are late to the party. Pharma-sponsored communities were happening in place over 10 years ago, and as companies withdrew from the arena, they made themselves irrelevant. In '97, MS Watch was launched, and it became the place to go to connect with other MS patients. It's one of the earliest examples of pharma engaging through a social network that I have found. It had an interactive educational program, which I found very helpful, and it was my first experience with pharma. The marketing actually was very effective. I requested their drug at time of diagnosis. When the community was being shut down, members were outraged. Their virtual home was being destroyed and buried. One quick-thinking member started a new forum for the misplaced community, calling it the MS Refugees community. The message sent loud and clear was that the company didn't care enough for their customers to continue supporting them in this way. It had been a great public service outreach, certainly innovative at the time, providing patient education, support, and tools, and definitely good marketing. With any marketing decision, think of the consequences. With the lack of trust and high level of suspicion with the industry, there is absolutely no way that another pharma company could attract the number of members that MS Watch once had. Currently, patients living with chronic disease often feel like they represent little more than market share. Fortunately, patients have many places to go now online, with each community offering something slightly different. Just a little bit of trivia, MS Watch had 45,000 members. The MS community at Patients Like Me currently has 22,000 members, only half of what the pharma-sponsored community once had. People are looking for information, support, validation, and a little bit of courage. Honestly, we're not talking about drugs so much. But in my writing, I do frequently reference studies and translate ISI and PI information for the average layperson. Somehow coming from me, it seems more understandable and credible. But what can one person do? My influence may be small, but with the help of others, my efforts can be amplified. It is when we work together that real differences can be made. So I challenge the pharma industry to consider working with their competitors to provide greater services and support to more patients. If you want to know how to approach me or my community, listen closely. Get to know me. Talk with me. Always be honest and transparent. Stop trying to sell me. Do tell me about updates with your product, both good and bad. Ask me what I need and what I want, and then give me more than I expect. If all you have to offer is a product brochure or a package insert or a drug compliance program, do I really need you? I don't mean, do I need your product which is assumed to be safe and effective? I mean, do I need your marketing? How do you benefit me if I can get more from my peers or doctors? What do you have to offer? Stop selling and start supporting. As an empowered patient, I expect injection training and financial support. I would like easier access to information. Don't make me research your drug or company. You might not like what I find. I would like to be asked, what else do you need to better manage your health? And a good word about advertising, don't fearmonger or condescend, and certainly don't be insulting. With this ad, there was a survey that I was asked to complete with lots of personal information. Afterwards, nothing, not even a link to the relevant product. If you want to reach empowered patients, you must offer something which isn't already available from peers, doctors, or other websites. Many times that is information. Sometimes it is assistance outside of the virtual world. Also, it is a belief that somebody actually does care about the consumer's needs beyond pushing drugs or gaining market share. Bottom line, do good for others, patients will notice. That's the best marketing of all. I want to thank Health Central for sponsoring me today, and thank all of you for listening.